When an older person has a fall, our first instinct, right, is to look for the obvious stuff: scrapes, bruises, maybe a broken bone. But what if the fall itself is just the tip of the iceberg? Today, we're going to get into the really crucial checks that should happen after a fall and why the most important questions are so often the ones that never get asked. Here's the thing you absolutely have to understand. A fall is almost never just an accident. Geriatricians will tell you it can be the first and sometimes the only real sign that something else is going on under the surface. Like a serious infection, dehydration, or even a problem with the heart. And this is where things get tricky. In a busy clinic or an emergency room, the focus is almost always just on the immediate injury. So a non-specialist might stitch up a cut, check for a fracture, and send the person home, completely missing what actually caused the fall in the first place. That creates a really dangerous gap in care. So, here's a better way to think about it. A fall is like the check engine light in your car. You wouldn't just slap a piece of tape over the light and keep driving, right? Of course not. You'd pop the hood and figure out what's wrong. That fall is a critical warning sign that demands a much deeper investigation. Which naturally leads to a really important question. When someone gets evaluated after a fall, are they actually getting the most useful, most effective diagnostic tests? Well, the answer, unfortunately, is often a big no. This is actually pretty surprising, and honestly, a little concerning. One study looked at older adults who went to the ER after fainting, and it found that the single most useful test was also one of the most forgotten. Doctors only did the simple sitting and standing blood pressure check in about 1/3 of cases. That means a potential root cause was missed 2/3 of the time. Okay, so what does a proper evaluation look like? Well, you can kind of break it down into a few key stages. We're going to start with the first one, the immediate diagnostic checks. These are all about finding that acute problem that might have pulled the trigger on the fall. These initial checks are basically detective work. First, you're looking for a new illness. Things like a urinary tract infection, pneumonia, even COVID can cause a sudden weakness that leads to a fall. Next up is that simple blood pressure check we just mentioned. And finally, some key blood tests can uncover hidden issues like anemia or an electrolyte imbalance. That sitting and standing blood pressure test, it's looking for a specific condition called orthostatic hypotension. It sounds complicated, but it's pretty simple. As we get older, the body's system for regulating blood pressure can get a little sluggish. So when you stand up, blood can pool in your legs, less of it gets to the brain, and boom, you get dizzy and fall. It's incredibly common, and often it's totally treatable. But listen, finding an immediate trigger like dehydration or an infection, that's really only the beginning. Once those things are sorted out, the investigation has to go deeper to uncover any chronic conditions or other long-term factors that might be piling up and increasing the risk of another fall. This part really involves 3 big areas. First, you need a deep dive into all medications. We're talking prescription, over-the-counter, everything. Second, an evaluation for chronic heart or neurological problems, like sick sinus syndrome or Parkinson's. And third, you've got to screen for osteoporosis, because brittle bones are what turn a simple fall into a catastrophic fracture. And that medication review, it's so critical that it's actually an official recommendation from the CDC. They say every single older adult who has fallen should have one, simply because so many falls are linked to medications that can often be adjusted or even changed. And these right here are the prime suspects. I mean, anything that affects brain function, like sedatives or sleeping pills, is a major culprit. But also, and this is a big one, medications for blood pressure and diabetes are critical to review. A lot of older adults are actually overtreated, which leads to their blood pressure or blood sugar dropping too low, causing that dizziness and leading to falls. So, beyond what's going on inside the body, we have to look at the body itself. The third crucial area of assessment is physical. It's about how a person is actually moving and interacting with their environment. This can tell you so much about their strengths and stability. This means a doctor should actually watch the person walk. They should do some simple tests for balance and leg strength. It also includes checking things we often forget about, like vision and foot health. I mean, you can't be stable if you can't see properly or if your feet are in pain. And finally, a quick look at the home for obvious hazards like loose rugs is just essential. Testing leg strength doesn't require any fancy equipment. There's this wonderfully simple and effective way to do it. Just ask the person to sit in a chair, cross their arms over their chest, and try to stand up. If they can't do it,
That's a crystal clear sign their leg strength is low, and they would almost certainly benefit from physical therapy.
And for balance, there's this simple 4-stage test. Each stage just gets a little bit harder. If a person struggles with the earlier stages, like say they can't stand with one foot directly in front of the other, that is a major red flag for poor balance. And just like with strength, this is something that can absolutely be improved with the right exercises.
All right, we've covered all the checks that should happen. But look, knowledge is pretty useless without action. So this brings us to what might be the most important part of all. How do you make sure these checks actually get done? Well, you do it by becoming a proactive advocate for yourself or for someone you love. The path forward here can really go one of two ways. With a passive approach, the focus just stays on the injury. Those underlying risks get missed, and the whole cycle of falling just continues. But a proactive approach, that changes the game completely. You become a partner in finding the root cause. You help create a prevention plan, and ultimately, you protect your health and independence.
In the end, it all comes down to being politely proactive. This isn't about being pushy or demanding. It's about being an engaged and informed partner in your own healthcare. Just by asking questions like, could a medication be contributing to this? Or should we check for orthostatic hypotension? You help make sure these critical checks aren't overlooked. So after everything we've talked about, from hidden illnesses to those super simple balance tests, it all boils down to this. What's the one question you'll now make sure to ask after a fall? Just thinking about that, well, that's the first step to turning a fall from a crisis into a real chance to get stronger and safer.